Longevity science, I think, no one really has a clear definition of what it is. The word longevity has a branding problem. People think that we're just trying to add years and years and years to our life, and that's not what we're doing. We want to add health span to your life, and so that's where we really focus our energies now.
Hello again, welcome to the Live Long podcast. I'm Peter Bowes. This is where we explore the science and stories behind human longevity. The goal is to optimize our health span and master the aging process.
This episode is a co-production with the Swiss longevity biotech company Timeline. We're in Las Vegas at A4M, the annual Longevity Fest meeting of the American Academy of Anti-Aging Medicine.
Dr. Darshan Shah earned his medical degree at the age of 21 to become one of the youngest doctors in the United States. Now an experienced surgeon with a deep knowledge in the areas of heart, cancer, trauma and general surgery, as well as plastic and reconstructive surgery, he is also the founder of Next Health, the health optimization and longevity center that we featured on this podcast a couple of years ago. You'll find it in our archives. Dr. Shah is also well known as a speaker and now as a podcast host with Extend, a podcast all about extending health span, much as we try to do with this podcast. Dr. Shah, it's great to see you.
Nice to see you. Thank you so much for having me.
It was a fascinating experience going to your facility in West Hollywood. I'm fascinated by health span and the explosion in interest that there has been, especially in this longevity space, in that kind of facility.
Yeah. So I think when we first opened Next Health, it was actually almost 10 years ago when we first opened our first office. It wasn't the one that you went to. It was a tiny closet of an office in West Hollywood, 1,000 square feet. And back then, no one knew what we were even doing. They're like, what is this place? You're doing longevity medicine? What is that? And so we had a lot of challenge actually explaining what this was. But what we found since the epidemic, basically, when people became refocused on their health, and they actually had a time to educate themselves by listening to podcasts, by listening and researching on the internet about health, that we saw a massive increase in interest in this field, longevity science. And, longevity science, I think, no one really has a clear definition of what it is. I think what we do at Next Health is really try to define what we're doing in terms that people can understand. And so that's kind of where we see the new mindset kind of going in longevity. And it's not, the word longevity has a branding problem because I think people think that we're just trying to add years and years and years to our life. And that's not what we're doing. We want to add health span to your life. And so that's where we really focus our energies now.
I like the fact that you mentioned that because there is a branding problem across the broader population. Some people think that because you're interested in longevity, living long, extending your life, that you are in some ways, I think it's disillusioned with how things are normally going to proceed, and that you are deluded into thinking you're going to live an extremely long time, 100, 120, 150, or even longer than that. And you nicely say it's all about health span, which is just really optimizing the number of healthy years that
exactly.
we have.
By optimizing our health span, we might get 20, 30 more good years. And so in my mind, that is lifespan, right? Yeah.
Well, and emphasis on life,
right?
Living life, which this isn't just lifespan, number of years that your heart is beating. Right. It's enjoying life, doing what you want to do with, if you've got children, your friends, if you want to travel and pursue a healthy career. It's all part of living.
Yeah, and I would argue your life actually doesn't end when you die. Your life ends when you develop Alzheimer's. You can't recognize your family. Your life ends when you're not mobile anymore because maybe you have a broken hip that doesn't heal, or your life ends when you get diagnosed with end-stage cancer. Like those are, in my mind, also life-ending events. And although you're still alive and breathing, you're not enjoying the world and your family to its fullest, right?
Exactly, yes. Right. So we'll talk a little bit more about Next Health in a moment, but I mentioned that you qualified as a doctor, got your degree in medicine at the age of 21. You must have started very young.
Yeah, I did, yeah. So I was fortunate enough to be introduced to biology very early from my dad, who was also a physician, and he brought home a fetal pig one day when I was, I think, in fourth or fifth grade, and this was 40 years ago maybe, and you couldn't just like go online and order one. So somehow he found a fetal pig, and I don't know if you did this when you were early years in biology class, but we dissected it at home. And that was just a game-changing moment for my interest level into this. And so once I got very interested in it, I was lucky and fortunate enough to have moved schools a few times. And that in itself was not fun, but I was able to transfer credits in such a way that I could rush through school a little bit. And then I went to this special program in the United States, of which there are only 5 programs, that modeled themselves after the British system, actually, where right after high school, you spend 6 years learning medicine instead of doing 4 years of college and 4 years of MD training. And so it's one thing after the other. I saved 4 years and I was able to graduate at 21.
So you understood quite early on that it was your destiny
Yes.
to be in the medical profession.
I think so. I don't know if I understood my destiny. I just had a lot of interest in it, I think.
And in part that's because of your father's work
Yeah.
and because of your studies in very early life.
Yes.
And did you recognize at that stage what you recognize now about healthcare? Because I talked to a lot of people in your position who say what they were taught at medical school really bears little relation to what they do now in practice, and that they weren't that well prepared for their profession as they left medical school, and a lot of it was learning in the years and the decades to come.
Okay, so that's a great question that you're asking me, because I think people need to understand the history of what happened over literally the last 50 years, okay? When I went to medical school now 30 years plus ago, I learned how to save lives, okay? And so you save lives by diagnosing cancer and understanding what the treatment algorithm is for that cancer with radiation, chemotherapy, what have you. You save lives by someone gets hit by a bus, you're able to do surgery on them. You save lives by someone has a heart attack, you're able to treat them with game-changing, life-saving medications in the emergency room. We were taught to save lives, okay? But what's happened over the last 50 years is this explosion of chronic disease, right? And so now with chronic disease, the healthcare profession during my time and even now is not, there's too much training you need to have to save lives. Turning around chronic disease, maintaining optimal health is just not in the, you're just not trained in that, right? And so, yeah, you're absolutely right. So when I got, like 10 years ago, I found myself in a really bad place with my own personal health. I didn't have the knowledge in my brain on how to turn around my personal health, but I did know what medicines I would need to take to mask the symptoms, right? And so that's kind of where I think you're right. I wasn't trained in how to stay healthy, but that's not what the medical profession was meant to do in the first place.
It was meant to fix a problem when the problem occurred. And
Exactly.
as I understand it, a lot of doctors say, they spent 30 minutes on diet and nutrition,
Right.
which is one of the major pillars, some would say the most important pillar
Absolutely.
of longevity. And so how did you gain the knowledge? What happened to you during your early years as a practicing doctor,
Yeah.
to really change your philosophy and change your attitude towards your profession?
Yeah, so 10 years ago, I found myself very sick myself, as I mentioned. I was 50 pounds overweight. I had metabolic syndrome, diabetes. I had heart disease, hypertension that was not controlled with medication, and an autoimmune disease. So all the bad things all at once,
And do you mind if I ask how old you are?
I'm 52 now.
52 now, so this is in your 40s,
This
early
is my
40s.
40s, right? Early
Okay.
40s, right? And so I also at that time had my first child. And so, like most of us, when we have our first child, it's a life-defining moment, and you look in the mirror and you say, what am I doing, right? And so I said to myself, what am I doing? I'm not going to be alive long enough to see this kid grow up, because I was a little bit older dad, 40. And I decided at that point to learn what I needed to learn to heal myself. And I went out there and learned nutrition. I got a nutrition certification. I became a personal trainer. I got a certification in how to exercise. And through that, I was meeting practitioners in a new field of medicine called functional medicine. And I was very interested. Now, this was very new about 10 years ago, but I was fortunate enough to meet some of the luminaries at that point in time who taught me about root causes of illness. And I applied that science to myself, and it worked. In 8 months, I was able to get healthy. And I said, this is the kind of medicine I want to practice. So completely, had a kind of a ramp off of my surgical career and a ramp on to this new.
And I guess there were some light bulb moments for you. You talked about your own personal health, but the people that you dealt with, the patients that you dealt with, the changes that you saw in people, or perhaps some of the progress that was made by your contemporaries, doctors that you were working with, were there light bulb moments that just explained things to you instantly, and you think, yes, that's it, I get it now. This is the direction we need to move in.
Yeah. So, a lot of the surgeries I was doing was on very obese people. They would see me in their consultative visits before surgery. It usually take about 6 months before the surgery got scheduled. And they would say, Dr. Shah, what are you doing? You look so good. And I tell them, let me tell you what I'm doing, And 3-4 months later, I would follow up with them for their surgery and say, okay, let's look at everything. You ready to book surgery? And they'd be like, you know what, Dr. Shah, I don't need surgery anymore. I followed what you were doing, and I don't think I need surgery. I'm just going to stay on this path. And so even though I wasn't able to do their surgery, I was like, aha, this stuff works. We're going to avoid surgery because of nutrition and sleep, stress management, physiological movement advice. And so that was one light bulb moment I had for sure.
And I think about this a lot, which of those key pillars of longevity, sleep, stress, diet, obviously, exercise, social connections, I think we're increasingly understand is very important to have people around us, like-minded people, friends, family. They're all important. But which one of those has been perhaps the most difficult to understand? And I would say it's diet. I think we understand what sleep is and how beneficial sleep can be. But diet, there are so many different views on the kind of diet that we should be following. We're all different. We all respond to food in different ways. What is your perspective there?
Right. So I actually don't like the word diet because it indicates that there's a certain pattern of eating that might be the right pattern of eating. And it's really not about that. In all of these areas, whenever I talk to my patients, I'm like, look, there's really 20% of the information that's going to move the needle 80% of the way for you. Yeah. It's a Pareto principle, if you're familiar with. And with diet especially, we tend to hyper-focus and go down the rabbit hole on nonsense that doesn't really matter. Really, the information that's going to move the needle the most for you is eliminating ultra-processed food from your life. Not just reducing it, eliminating it. Ultra-processed food was not around 60 years ago. This is a man-made created problem in our biology.
And just to help people understand what you mean by ultra-processed food, there's some food that's just slightly processed. You chop an apple and store, it's slightly processed.
Right.
It's still in its raw form, but slightly processed. So what is ultra-processing?
Okay, very important to be clear with this definition because I think a lot of dietary inaction happens because of confusion about all these terms, right? So I'm so glad you asked me that. Ultra-processed food, there's actually a classification system called the NOVA classification system. And the way ultra-processed food is defined is food that is not really food anymore. It is created in a factory. It is in a packaging of some sort. And you look at the ingredient list and it's more than 4 or 5 ingredients. Many of the ingredients you cannot pronounce because it's basically a bunch of chemicals that's been put together in a very hyper-palatable, non-nutrient dense way to just provide you with energy and calories and to keep you eating more of that food because it's profitable for the food company. So it's all of the stuff in the United States is located in the center of the supermarket. 90% of our supermarket real estate in the United States is ultra-processed junk that's being sold to us at very low prices and high taste value. So people just keep eating more and more and more of it. And so it's, for some examples, are chips, cookies, pastries, white bread, packaged meals that are frozen. All of this is garbage. It's not real food.
And it still shocks me that I go to a doctor's office and I sit in a waiting room and there's a vending machine full of exactly what you're talking about. Here at this conference in the eating area at the back of the expo, all of that kind of food. If people like yourself medical professions at an event like this. I mean, maybe you're not in control of the food that's being sold. I know,
Right.
I understand that. But what I'm saying is, it's kind of endemic in society. This way of, this convenient way of eating this ultra-processed food. So
Right.
I suppose the question is, what needs to happen to get around that and to stop it happening if it is so unhealthy for us?
Yeah, so I mean, the reason it's there in the vending machine that is ubiquitous everywhere is because it can be stored for a very long time. If you try to store a banana in a vending machine, it's not going to last very long. And it's also very profitable to 10 major food corporations in the world to have that there in front of you so you can catch you at a weak moment and you just buy it, right? And they make it for pennies and they sell it to you for dollars. They're making so much money on this. So I think to answer your question, it has to be a grassroots movement that people just stop buying it. Okay. This is a $1 trillion industry with companies worth billions of dollars that aren't going to go away until they get bankrupted, basically. And so how do we do that? We either force them through policy, like it's happening now in the United States, where certain ingredients are getting banned. But you ban one ingredient, they'll create another one. It's just, that's what they have hundreds of chemists hired to do this, right? So it just has to be people have to stop eating it. That's the solution.
So I asked you which is the most difficult of these major pillars to really get to grips with, to understand, to recommend to patients the avenue that they should go down. I think because that is one of the big areas of confusion, isn't it? That people will look on the internet, they'll get a little bit of advice from here, a little bit of advice from there, and ultimately be confused as to the way forward that's going to be best for them.
Right.
How do you address that confusion that we see in society through this deluge of information from billboards, from television, the internet, clearly, podcasts? Yes,
Yeah.
I mean, you don't necessarily believe what you hear on a podcast, I mean, apart from yours, of course.
Yeah.
But you see what I'm saying? That there's so much confusing information out there that it leads people to throw up their arms and say, well, I don't know, I'm just going to do what tastes good.
Yeah, I think there's definitely a temptation to give up, right? But I think that we now have really good information out there, and a lot of people with good backgrounds spreading good information. And so I think you have to look at who's giving you the information. Right. Most of the people on social media have no degree whatsoever, and you can tell when someone's selling you something. It's humans are very smart. If someone's selling you something, they're either saying that their method is the best way and the only way, and everyone else has no idea what they're talking about. The people that are not trying to sell you something are very nuanced, and they give you the pros and the cons for everything. But with all of the advice out there, there are some overarching themes that if you, like the Pareto principle, if you follow this one thing, you'll get most of the result. And then you can figure out what's right for you. Okay, so I'll give you a perfect example. I had a patient about a week ago that said, you know what? I heard that I need to get more protein in my diet because I was listening to this podcast. And so I started buying all these packaged meats that, and I keep packaged meats around all over the place. So instead of snacking on nuts now, I snack on processed meats because there's more protein content in them. And I was like, you broke the primary tenet to not eat the ultra processed food, right? And so, I think that's how people get confused. And so we cut through the confusion. I said, I don't care what you eat, as long as it's not ultra processed. Get that part right first. And then let's focus on your protein requirements, your fiber requirements, your nutrient requirements. But once you eliminate the ultra processed food, whatever else you eat generally is going to be pretty healthy for you, as long as you're getting enough fiber and you're meeting some protein requirements.
This episode is brought to you by Timeline, the Swiss longevity biotech company, which is pioneering a new category of clinically validated dietary supplements called mitoceuticals to support healthy aging. Mitopure delivers Urolithin A, which has been shown to enhance cellular energy, muscle strength, and the health of our skin. To find out more, go to the show notes for this episode.
So let's talk a little more about Next Health then.
Sure.
So you as you say, you're a decade old now.
Yeah.
And you're progressing all the time.
Mm-hmm.
And for anyone who's never been to somewhere, and that's probably most people around the country, around the world listening to this, you describe to me what it's like. There are interventions like cryotherapy, red light therapy, there are intravenous drips. What is your primary goal?
Yeah.
What was and what is now your primary goal with Next Health?
Yeah, so my primary goal is and always has been to completely reinvent healthcare as we see it. And so the old model of healthcare was not really healthcare, it was disease care, right? So you go to a doctor, they figure out if you have a disease, and then they give you a pill or recommend a surgery for you. What real healthcare is it's very proactive. It's something that you don't just do once a year at a visit to a doctor for a yearly physical. You're doing it on a weekly, monthly, quarterly basis. And also, going to a doctor's office is not very inspiring. It feels like you're in a diseased environment. It feels like you're going to a hospital sometimes. We wanted to create a very inspiring, beautiful place that people want to go to often. And so when you go to a Next Health, the journey is when you come in, we're going to measure many biomarkers on you, blood tests. We're going to put you on a special scale that we have that gives us your skeletal muscle mass. We're going to do genetic testing swab. And we're going to get all the data. And then we're going to look at it at a lens with a doctor. We have a doctor at every location. We're going to look at it at a lens of not just diagnosing disease, but which way are you headed? And how do we prevent you from ever having a disease in the first place? So we put a program together for people using that data. And then we have tools and technology on site, the things that you had mentioned, that people can interact with on a weekly basis. So number one, they can do some self-care. Most people don't do self-care anymore at all until they go on vacation 1 week a month, 1 week a year, you know?
Yeah.
Your self-care has to be for at least 2 or 3 hours a week. And so we provide people a place to go get some self-care, sit in a sauna for 30 minutes, do some cold therapy for a few minutes, sit in the hyperbaric chamber, get an IV therapy nutrient drip to supplement your nutritional needs. And people do that for 2 or 3 hours a week. And this sets up kind of like this self-fulfilling prophecy where you're coming in, you're thinking about your health, you're doing something about your health, you're getting tested, and this is what's going to move the needle.
And what's the proportion of, in terms of the benefits between long-term potential and scientifically proven long-term benefits, and just the here and now and the feel-good factor of, as you say, a little bit of self-care, a little bit of pampering in the hot sauna, the cryotherapy, whatever is good for you. Yeah. What proportion is scientifically proven to at least extend our health span?
As far as the technologies that we do?
Yes.
So let me be very clear. Most of the benefit is going to come from getting your nutrition, sleep, your exercise and movement, and your stress management right. That's going to be 80% of the benefit. This adds that top 20% on to that, where you can make changes faster and they're more long lasting. I would say the technologies that we have in our clinics have been proven from years and years of studies. So you might be familiar, there's massive studies on sauna use, having more benefit than any other therapy for reducing cardiovascular disease, except for lowering cholesterol levels. With hyperbaric oxygen therapy, where I trained at the Mayo Clinic, we would actually use hyperbaric oxygen to treat people that had strokes, had unhealing wounds or surgical problems. And so bringing that technology to the public before they're sick in a hospital setting still has the same benefits. And so we only bring technologies in that have proven benefit, and that's why we're doing them.
And how do you open up those benefits and the opportunities to everyone? Because clearly there is a fee for this, right, and it is beyond the means of quite a lot of people. So how do you equalize it in terms of opportunity?
Yeah, so our plan is we're scaling now very rapidly. We have 6 locations. We're going to be opening 25 more in the next year and hopefully 100 more in the next 3 years. With scale, we're going to drive costs down so people can do this at a even lower cost than we're doing it now. So if you look at our price points right now, we have memberships that are $99 a month and even $300 a month. Now, a lot of people spend that amount on their gym memberships. What our goal is we have the health savings accounts in that people can put money in every single year instead of paying for insurance, right? So they can put some money in before taxes are taken out into what's called a health savings account. Right now, that's at $4,000 a year maximum. We're working with the government to increase that, but what we're trying to do is within that $4,000 a year, be able to take care of all of these treatments for people, right? And so when we do that, now, instead of spending money on health insurance, you're spending money on your health savings account, which is preventative. Health insurance, as you know, is very reactive, disease focused. And so we just want more people to just use money that the government allows you to put away pre-tax to do this.
And are you working closely with the insurance companies, with government? And clearly we've got a new administration here in the United States that I think a lot of people are just waiting to see what happens. There's some interesting ideas flying around in Washington about healthcare at the moment. What I'm saying is, do you have other entities on board with your goal?
100%. I mean, at this conference, I had conversations with at least 25, 30 people that are also getting involved at the highest levels of Washington, D.C. as I am to move the needle in healthcare. It's a really good moment right now where there's actually a lot of talk around focusing on health versus disease care.
And do you think the message that you've eloquently described in terms of the understanding of what healthcare should be, that it isn't fixing diseases, it isn't, well, we need to fix diseases, but it isn't fixing problems as they occur, it is preventing those problems in the first place. Do you think that is getting through to people, that en masse there will be a general understanding? I think a lot of people will still think the doctor is there, you get sick, you go and see the doctor and hopefully you'll feel better. But this other way of thinking, which and I agree with you, is that getting through to people?
I think absolutely it is. I mean, in the United States, we have 90% of people that have some level of metabolic disease. We have 50% of people that say they don't feel well. And, as Dr. Mark Hyman always says, people are sick and tired of being sick and tired, right? They're going to their doctor, they're not getting what they need, but they have nowhere else to go. By companies like Next Health and other companies providing a place to go for health, I think people will experience it as they are in the markets that we're in right now and tell their friends that this is where you go for true health care, optimizing your health, avoiding disease, preventing disease, and the other system is there for disease care. So, we're at the beginning stages of this, but there's going to be two parallel systems. One is the hospital insurance, pharma system, and there's going to be a health-focused system.
What interventions do you use yourself, and what are you most excited about in terms of the science?
So I would say for myself, the interventions that I use are mostly diet, sleep, and exercise related. Every day, that's what I focus on. I do top it up with some supplements that I take, and I do also top it up with using some of the technologies that we mentioned, okay? If I don't get my supplements in or the technology in on a particular day or even for a few days, like traveling to this conference, It's not the end of the world. But it would be the end of the world if, for me personally, if I ate a bag of chips and a Twinkie for lunch, or if I went to bed at like 3 a.m. It wouldn't be the end of the world, but it's like, I try to avoid that at all costs. And I think the stacking of doing these things day after day is what really moves the needle for my personal health. And I think for most people, that's what's going to move the needle, stacking these things up as much as you can day after day after day and having very few off days, And that's my primary. Secondly, there are some supplements that I consider foundational and I recommend to all my patients and I take them. And then lastly, at least once a week when I'm not traveling, I try to do some sort of heat, cold therapy. And, because I have Next Health and that's where I go to do it, I'll try to do something like LED light therapy, hyperbaric if it's available and I have time. And then when I'm traveling or if I don't feel good or sick, or if I've just been sick or if I just had a really rough week and haven't been able to eat good, I'll do a micronutrient IV as well.
And what aspects of the science, and maybe you've seen some technologies this weekend, that looking to the future excite you? Things that are maybe not quite there yet, but the potential for the future. I know a lot of people are talking about artificial intelligence in terms of data gathering to help you communicate with your health professional. What excites you looking ahead?
So artificial intelligence is here right now. Everyone has access to ChatGPT for free. So everyone should put in their latest blood work that they got, ChatGPT, give it your health history, and just ask it, what are you seeing here? What are some of the things I should be concerned about? And get that data and research that from ChatGPT.
Is that as simple as a cut and paste from the report that you get from your doctor, from your blood, cut and paste and
Exactly. You don't even have to type it in or anything. You could just upload a PDF of it to ChatGPT. It'll read the PDF. It'll give you some information.
And the information you get, is it reliable?
Yes. Yep. It wasn't in the first version of ChatGPT. I find it to be, 99% reliable now as far as giving you interpretations.
Right.
You can, of course, ask it for medical advice and treatment advice. I would not do any treatments based on artificial intelligence without talking it through with a skilled professional. I want to be very clear about that, especially when it comes to pharmaceuticals, supplements, or anything else. Now, I will say there's another treatment that is becoming more popular now in the longevity circles, and that's one that is called therapeutic plasma exchange. Plasma exchange is a treatment that's been locked up in the hospital setting now for almost over 50 years. We use it for emergency situations. It's where we hook a person up to a machine, we separate their plasma from their blood cells, and we put the blood cells back in their body, but we replace the plasma with albumin. And what this does is it removes all the toxins that have built up.
So this is a cleansing process.
Cleansing. It's like an oil change for your body. And you can see the plasma come out that we've taken out is dark and foamy sometimes, and it looks not clear. But then when you put the albumin back in, it's completely clear and fresh. And this gives your body a chance to catch up with its toxic burden. It removes all the inflammatory cytokines, removes all of the protein malformations, all of the toxins like mold and microplastics, BPA removes anything that's in your plasma is removed. And so I'm really excited about this because this is not giving someone a drug. This is removing the bad stuff. And we're seeing massive changes and benefits for patients.
And what does the practical process look like?
You come to the clinic, you sit there in a chair, we put an IV in your arm. It's about a 3-hour treatment where you have an IV and you just basically can watch some TV, listen to a podcast, what have you, and it's very comfortable. And that's it. You're done.
And how frequently?
It depends on each person. So we look at many biomarkers before we do it, and depending on the toxic load, we come up with a protocol that's going to work for the person. And what I find is some people clear fast, some people take longer to clear their toxins, and that has a lot to do with the health of your liver, has a lot to do with the health of your kidneys, how much you detoxify yourself, and how much you're exposed to, right? So all those factors build up in your plasma. So it's different for each individual.
Let me ask you just in closing about your podcast,
Yeah.
which is a relatively new adventure for you. Why did you want to do it? How is it going? What are you getting out of it?
Yeah. I wanted to do it because of 2 reasons. I see a lot of patients and I say the same things to a lot of people over and over and over again. And when you're doing that, you realize that everyone needs this information. And so a podcast is a really good way to get that information to a lot more people. I'm not writing a prescription for everyone that comes to my office. 90% of my time is spent talking about exercise, sleep disorders, nutritional information, supplements that they should be considering. So why not tell everyone this information, right? And so that was one reason. The second reason is because I'm actually the physician for a lot of people that have large podcasts themselves. And they all told me you need to do a podcast and they will be on my podcast. And so they're very gracious to offer that. And so I get to have these incredibly focused 1.5 hour conversations with some of the smartest people in the world. And there's no phones, distractions. There's no one has a time limit. We've just carved out a couple of hours to have this beautiful conversation that can benefit a lot of people. And so honestly, I think it's the best thing I do now. It's the most fun and inspiring thing that I can do is do this podcast. I look forward to it every single time.
And as someone who has moved really from practicing medicine full-time to someone who is now a communicator, an entrepreneur, how do you feel about that transition in your own life? In other words, what do you get out of your own career path, which has changed quite significantly from those early days? What inspires you to continue doing what you do?
Yeah. So when I was doing surgery on people that needed to get healthy first, but they had no way of getting healthy except for doing the surgery, it's actually kind of soul crushing. I got really burnt out from that because you feel like you're not really making a difference. You might make a difference for that one person for that one moment, but in reality, they need to change a lot of things. And people just didn't have that information before. And so now I'm inspired to wake up every single day and do the things that I do. And I feel like, this change for me is so much more fulfilling. I feel fulfilled every single day.
It's an exciting career,
Yeah.
and I wish you all the best.
Thank
Continued
you.
success, Dr. Darshan Shah. Thank you very much.
Thank you so much. It's so great to be here. Thank you for having me.
The Live Long podcast is a healthspan media production. I'm Peter Bowes. You can contact me through our website, livelongpodcast.com, where you'll also find show notes for this episode.
This podcast is for informational, educational and entertainment purposes only. We do not offer medical advice. If you have health concerns of any kind, or you are considering adopting a new diet or exercise regime, you should first consult your doctor.